All right, good morning, everyone. So what is today? Wednesday? We're halfway through the week, or Tuesday? It's Tuesday. I'm losing my mind. But I'm not going to lie, getting up at 8 a.m. to do this live was extremely difficult. We are trying to get our kids out of the house this morning. So I'm going to have to keep this very brief and short and sweet is what I want to call it. So today's topic is which ICU is best for CRNA. So you'll hear a lot, and if you've already started to think CVICU, I want to try to challenge that a little bit, because not necessarily, it doesn't really matter the type of ICU unit as much as it matters the acuity of the unit, okay? So high acuity, that is the most important factor when considering what ICU for CRNA. And this could be a neuro unit, this could be a surgical trauma unit, just the trauma alone unit. It could be, I've even seen I've seen students work in like a burn ICU that's attached to, say, a surgical ICU, medical ICU, CVICU, CCU, all of those types of units count. You do not have to work in a CVICU to pursue CRNA. So I just want to say that right now. That's thrown around a lot. But I ask, like, why do you think that is? Why do you think people recommend CVICU? And I'll tell you my thought around why they recommend it. But you can also get this in other units, and I'll kind of explain that. The reason why I think that's commonly sought out after and thrown around for CRNA school is because typically you have access to advanced life support like ECMO, balloon pumps, things like that. Ventilators, because they're coming, if they're fresh open heart, they're going to be on a ventilator, not for very long. And I will tell you, I did open heart for 5 years and dropped those patients off. And yes, some of them were very hemodynamically unstable, and it did take a lot of management of vasopressors, but it was usually very temporary. I came from a MICU background, and those patients were respiratory cripples, extremely sick, tons of comorbidities. I mean, I think when you have tons of comorbidities that play into the picture and your lungs are failing, those patients are extremely sick. Where an fresh open heart, they're hemodynamically unstable, and yes, they have, some issues with their heart that, but you're supporting that, and they come to you supported, and then obviously it's up to you to maintain it. I don't know. This is my own personal experience, so don't throw daggers at me, but I feel like the MICU patients, in my experience taking care of them, could be they were just extremely sick, And no matter what you did as far as adding additional maneuvers, methods to help them, they still got sick and sicker and sicker. So anyhow, I just want to put it in perspective. However, managing advanced life support like ECMO, balloon pumps, that's great. Those are great skills that you should do, not because you're going to be doing balloon pumps in the OR, but because you're managing an advanced life support modality and you're understanding the physiology and the process behind that, which kind of leads me, I'll kind of skip around a little bit, but leads me into, you need to challenge your critical thinking, okay? And, when you do drips, ACLS, advanced life support, all of these things challenge your critical thinking. So that is why, again, high acuity is where you need to be for your ICU experience. I wouldn't get hung up on whether you go to the CICU or MICU. You're going to get good experience either way, as long as you challenge yourself to take those really sick patients, ask to get trained for advanced life support. Maybe it's Prisma. You don't have to have it all, too. Don't try to kill yourself thinking, well, I'm going to spend a year in the MICU and learn how to manage those patients, and I'm going to spend a year in the CVICU and manage those patients. You really want to hone in on your area of specialty and really advance yourself in that arena. The reason for this, you don't want to jump around. Well, first, it kind of makes them think, well, why can't they stick around at a place? Is there a problem? Like, are they having issues with their coworkers? Are they hard to work with? Why are they bouncing around? But it also, they know that the less time that you spend on a unit, the less likely is you're going to take leadership roles, right? They're not going to put a brand new trainee into a charge nurse position, so if you're bouncing around all the time, you're not going to have as many opportunities for leadership, which we talked about a little bit yesterday. So again, you want to try to pick a place where you can stay, get leadership roles, really take the sickest of the sickest patients they have on their unit. precept, those types of things. And so you really want to stay put. So again, one other thing I want to caution you guys about ICU experience is ER. I mean, so many people want to do ER because it's kind of, I don't know, not glorious. What's the word I'm looking for? Glamorous. That's kind of glamorous. Like cool, you're triaging really sick patients, right? And then you're kind of getting them off on their way. They come in from the street and, they're dripping blood. I don't know. I don't know. I've never worked in the ER, but I can only imagine it's crazy. So for whatever reason, that tends to be attractive for a lot of new nurses who want to get like right in it, The problem with ER experience, you guys, is it's short term. It's not long-term management. And that is exactly what CRNA school wants to see. They want to see long-term management. They want to see you challenge your critical thinking skills and see the management unfold so you really get a good understanding as to how you treat certain disease processes and how it plays out with the pathophysiology, pharmacology of that. Where in the ER, yeah, you might be starting to levo drip or epi drip or whatever, but then you get them to the ICU. You don't see how that unfolds, and you don't see what other modalities they need to do to stabilize the patient. Yes, you do codes. I get that, but know that a lot of schools do not consider ER experience critical care. They just don't. Now, if you know 100% your school full-fledged ER accepted, cool, then go for it. I'm not poo-pooing ER if you know your school takes it. But if they say on an individual basis, that should be a huge warning red flag saying that's not the preferred experience. So why would you get the non-preferred experience when you're going into a competitive application? I don't think you should do that. Same thing with NICU, PICU experience. Most schools will take PICU, but not all take NICU. Some take them both equally. So again, if you know this stuff ahead of time, prior to graduating nursing school, you can make better choices. And so even while you're in nursing school and you're picking your nurse's aide job, you should be researching what ICU is best for CRNA for your program and know whether they take ER, NICU, PICU. And so that way, when you pick your choice, when you're going in for a nurse's aide job, you can pick wisely. Because again, remember, like I spoke about yesterday, getting that nurse's aide job in the ICU is really going to give you a nice segue into a residency program. And when you work really hard in these units and you get the nurses to know you, like you, they're going to want to hire you. And so it's a long-term job interview if you work as a nurse's aide in the unit you take after residency. Okay. So picking the right unit early on will save you headache later. If you pick the ER as a nurse's aide and then it's hard to go into the ICU from there but they want you in the ER, well then it's kind of like, well, you know what I'm saying? So just kind of set yourself up for success in that area early on, and just research your schools. That has to start very, very early. You need to be researching what your school requires, going to the open houses, networking, those types of things to really help you understand how you can best prepare for CRNA school. But I will say, you guys, without critical care, without critical thinking, your ICU experience is useless. It really is. That's what you're there for. You're there to gain this critical thinking and understanding the complexities of the ICU patients you take care of. And many interviews will essentially assess this in your interview. Now, don't get me wrong. There are a lot of schools who put a lot of focus on emotional intelligence versus clinical knowledge, because their explanation for this is you can be taught. And they also know that if you came from a high acuity ICU, you've more than likely established this to some extent. And so that's why they don't hammer you on clinical scenario questions. But all school interviews are a little different. Some really will hammer you on clinical scenario questions, and they're assessing your critical thinking and what you have gained from your ICU. They know that students who come in with a good critical thinking baseline tend to be able to pick up a lot of these advanced concepts more smoothly and readily. One thing that inside CRNA School Prep Academy, the workshops, I know I've talked about this a lot, but it's true. We essentially help you kind of critique your critical care thinking by teaching you the type of information that's going to help you in the ICU as well as your time in CRNA school. the information we teach you is exactly the types of information you're going to learn in school. You're just going to be using it and applying in ICU. We did this. The reason why me and Richard made a learning library for you is because we want this to happen.